Welcome back to the show, everybody. Thanks so much again for tuning in. And today I'm going to be doing a solo podcast, and I'm going to be doing it on prescription sleep medicines. So I've done many podcasts in the past on circadian rhythm. I actually did one just a couple episodes ago. I've done some others where I've gone through some supplements, but I haven't done one specifically on prescription sleep meds. And some people have asked for this, so that's what I'm going to be doing today. But just before, I get into this, I do want to say that, if you can avoid prescription sleep medicines, please avoid them. And there are other ways that you can better sleep at night, without using prescription sleep aids. And I'm just going to go through them briefly. But like I said, I have done past episodes on this before. Again, I did one on circadian rhythm just 2 episodes ago, episode 189. So you may want to check that one out first. But I'm just going to go through them briefly again, just before we get into the prescription sleep aids. So, first of all, bright light exposure in the morning, getting a small meal in as well, even if it's just a shake. That's what I do. Having some kind of social interaction, if you live alone, just give someone a phone call, that can be helpful. Take a cold shower in the morning. That can kind of increase your cortisol level, make you feel a little bit more alert. There's some evidence also too that it can increase your dopamine levels for about 2 to 6 hours, which is pretty cool. Have your coffee early in the morning. Some people, such as Andrew Huberman, say to, skip the coffee for the first 30 to 90 minutes. Other people are now saying, that's not necessary. For myself, sometimes I do it, sometimes I don't. I don't really find a huge impact either way. So you'll basically just do what works for you on that one. The licorice root extract is something that some people also utilize in the morning that can increase their cortisol. You do have to be a little bit careful with that one, just because it does have some interactions overall with some different medications and supplements. And again, just real quick on the cortisol. So, people think cortisol is bad. Cortisol is not bad. What you want to do is you want to have high cortisol in the morning, gradually fade throughout the day, and have lower cortisol at night. And that's the cortisol that you want to have in your body that's going to be helpful for regulating your overall circadian rhythm, getting better sleep at night. So high cortisol at night, yes, is bad for sleep, but having no cortisol is not good because you're not going to have energy. Avoid working out too close to bedtime. Doing that again can spike cortisol and just kind of make you feel too alert. And so, try to avoid doing that. Have some kind of wind down routine, 1 to 2 hours before you go to bed. Wear blue blocking glasses, something I do all the time. Keep your room temperature around 60 to 68 degrees Fahrenheit. I know that sounds a little bit cool to people, but many studies show that that is the optimal room temperature. Again, if you need it to be a little bit higher, go for it. Even a little bit cooler, go for it. Although, getting below 60, I imagine, is going to be very, very cool. Sleep in a dark room. So have some blackout curtains if you can get access to them, or just make sure that, your room is as dark as possible. White noise is something that some people find to be really helpful as well. They find it to be very common. So, you can do that. And then obviously pee right before you go to bed as well, because, if you're going to be waking up at night to go to the washroom, that's going to disrupt your sleep. You're not going to be able to get into those deeper stages of sleep, which we know are critically important, REM sleep and deep sleep. And I will be talking about those throughout the podcast today. Practice forgiveness as well. Don't go to bed angry. That's something that we hear all the time, but there's actually been studies that have shown that practicing forgiveness can actually have, a pretty decent impact overall on sleep. I put a tweet out on that recently on my Twitter account and linked the PubMed link to that as well. So there is, evidence for that. So don't go to bed angry. Forgive people before you go to bed. Those are, most of the behavioral modifications you can do. But CBT, or cognitive behavioral therapy, this is the first line treatment for sleep disorders or for insomnia. And so, even in the medical literature, they do recommend CBT before using sleep aids or prescription sleep aids. So, go see someone, do some CBT on yourself. If you, feel like you can't go in to see someone, I'm not saying for sure, ChatGPT or these AI things can really be super beneficial for CBT, but there does seem to be some evidence that they can be beneficial, some regards to therapy and things like that. So maybe they can be beneficial for CBT as well. So you may just want to chat with it about that, about what's on your mind and what you can do to improve your sleep at night. Some of the supplements, I've mentioned these before that have the most evidence: tryptophan, glycine, L-theanine. The doses are going to vary, but for tryptophan, it's usually 1 to 5 grams. You'll start off obviously with the lowest. Glycine, it's going to be more like 3 to 5 grams. Some people might even need less than that. That's generally what's considered to be helpful. L-theanine, it varies quite considerably, 100 milligrams to 400 milligrams. There's some people who take L-theanine that find it to be a little bit activating. And ironically, L-theanine is something that can be taken in the day. There's studies that have shown when you use it with coffee, it can be synergistic. So you get the benefits of feeling alert from the coffee and the caffeine, but you don't really get that jitterness when you're using the L-theanine, which is kind of interesting. Magnesium, there's a couple different forms here. So magnesium glycinate is a form that a lot of people use at night, around 400 milligrams, can be helpful for sleep. But also, Dr. Andrew Huberman recommends magnesium L-threonate. There is some evidence that can cross the blood-brain barrier a little bit easier and potentially can be helpful for sleep, although I think there's less evidence with the magnesium L-threonate than just with the magnesium glycinate. But I'm not necessarily convinced that one is necessarily better than the other. I think that we've just studied glycinate more, so I wouldn't be surprised if magnesium L-threonate is superior, or at least is as efficacious overall as magnesium glycinate. Some evidence for valerian root as well. I know a little bit less on that one, so you'd have to check the dosages maybe with someone else on that. Omega-3 fatty acids and vitamin D. Those two things, should be in your routine anyway. I wouldn't necessarily, suggest taking those ones at night. Vitamin D is fat soluble. You do want to take it with some fats. The omega-3 fatty acids, particularly the EPA, can be incredibly beneficial for your mood, but also for your cardiovascular health as well. I'm taking up to like 4 grams a day of the EPA right now to improve my omega-3 to omega-6 fatty acid ratio. And I did a full podcast on omega-3 to omega-6 fatty acids earlier this year, maybe actually just a couple months ago, if you want to go check that one out. So again, those are the mainstay treatments that you should be trying before you look into prescription sleep aids. And for the majority of people, they are going to get a great night's sleep by following all the guidance that I just mentioned. So, the behavioral modifications I mentioned, CBT, and then also some of the supplements that I mentioned as well. If I did leave anything out that you guys feel is beneficial, please leave me a comment or send a message, and I'll certainly look into it and discuss that. So let's get into the sleep meds. And just before we start with that, you do need to understand that the sleep medicine has to match the problem. So there's not necessarily one sleep med that's going to work for everybody, because everybody has different issues and why they are falling asleep at night. So for some people, it may just be that they're in a lot of pain, so they need something to help reduce their pain. And there's different kinds of pain as well. So, some medicines may be beneficial for like osteoarthritis type of pain. Some medicines may be beneficial for like neuropathic pain. Neuropathic pain would be like things like sciatica, things that cause numbness and tingling, that kind of thing. Other people are going to have nightmares. Other people are going to have, a circadian disalignment. So there's going to be various different things that people have that are going to need to be geared towards their particular prescription sleep aid that they may choose. And again, obviously, do this with your doctor. So let's get into the different sleep medicines and the different classes and what they can be useful for in each particular type of sleep disorder. So one of the ones that I want to chat about first, I have first on my list here, is called DORAs, or they're dual oxyrexin receptor antagonists. So these are medications like Orexin, also known as Dayvigo. So the way that these medicines work, and these are kind of interesting because they're fairly new, is that they are for just primary insomnia. So, they're not going to treat pain. They're not going to treat, say, if you have like nightmares. They're also not going to, treat anxiety, which also can cause a lot of issues at night for people with sleep. And what these do is that they act on the oxyrexin A and oxyrexin B neuropeptides. And these peptides, they promote wakefulness and arousal. And so when you're taking these DORAs like limborexant, what they can do is that they can block those. And then because of that, it doesn't make you feel as awake. And just your overall normal processes of going to bed usually take over. And people often report getting better sleep overall. And so how do these medicines affect sleep architecture? And so sleep architecture, that's going to be your sleep latency, or how fast you fall asleep, your total sleep time, so the amount of time that you are actually asleep, your sleep efficiency, which is going to be, how much of the time that you're actually in bed is actually spent asleep, and then also your deep sleep and your REM sleep. And so when we're looking at these particular class of medicines, what they found in studies and RCTs and meta-analysis is that it does reduce sleep latency, which is excellent. It's been shown to reduce sleep latency by up to 15 to 30 minutes, which is pretty significant. It increases total sleep time for 30 to 60 minutes, sometimes longer, which again is a fairly excellent response. And then it doesn't seem to have too much of an effect on REM sleep overall, on deep sleep, but it does seem to actually increase REM sleep, which is very, different from some other sleep meds, which I'm going to get into a little bit later. So again, reduces your sleep latency, so it gets you to sleep faster. It's going to increase your total sleep time. And then it's also going to improve your sleep efficiency, or how much time that you spend in bed asleep, as opposed to how much time you spend in bed awake. And then it also has that unique effect, again, of increasing your REM sleep while actually sparing your deep sleep, or having a neutral effect overall. And so these have become, quite a bit popular over the last few years, again, because, they do have that, fairly good literature on overall improving sleep architecture versus some of the other medicines. But again, you need to be careful with sleep medicines. They all do have side effects, and I'm going to talk about the side effects for each one of them. Sometimes you can feel a little bit groggy the next day, which you may have expected. And for some people who suffer from sleep paralysis, they can find that these medicines can make them actually a little bit worse. And just through talking with some of my patients, they've discussed that when they use this medicine with THC, which again, I'm not recommending, but when they use this medicine with THC, they find that they can have more sleep paralysis, which is, really an uncomfortable side effect to have. So, you do definitely want to look out for that if you are going to be taking this medicine. And you also want to start with the lowest dose and then increase to the highest dose. So that's kind of the one that I wanted to chat about first. And, just before I move on, some of the other things there that I want to mention about is that you generally don't have much of a tolerance for this. So you don't develop much of a tolerance for this particular medicine. Which is good overall, because some of the other ones, you can develop a tolerance for it. So just be careful about that when you are looking into sleep medicines, because tolerance is obviously something that you do not want to develop. But like I said, luckily with these medicines, it doesn't seem to be too much of a concern. So let's move on to another class of medicines. So these have a really funny name. They're often referred to as Z drugs. So these would be Zolpidem or Zaleplon or Zopiclone. Zopiclone is one that's often most prescribed in Canada. And what these medicines can do is they can actually bind to one of the GABA receptors. And so when they bind to one of the GABA receptors, they can really decrease our sleep latency. So how fast that we fall asleep. And they can increase total sleep time, but unfortunately, they can also really reduce our REM sleep, especially over time. So, you may feel that you're, falling asleep faster, and you may feel that you're even sleeping more. But when you wake up, you may not feel like you have, as much emotional resilience as usual. Because, as I've indicated in the past several times this podcast, your REM sleep is like overnight therapy. And so when you're reducing your REM sleep, you're just not going to feel as good the next day. Your cognition, sometimes your mood is not going to be as good. So you do want to be careful with this class of medicines. And then in terms of deep sleep, unfortunately, in the long run, they can also decrease your deep sleep as well. And so, these should really just be used very, very sparingly and just for a very short period of time, like 7 to 10 days, no longer, in my opinion. Now, some people will, swear by them. They said that they've used it for forever and that it's, excellent for the sleep overall. And, if that's you, then fantastic. And, you want to, continue using that on the guidance of your doctor, great. But, I'm just giving you the overall evidence on it. And, I chatted with a psychiatrist on my podcast maybe a year or so ago. His name was Dr. Chris Aiken. And, what he kind of finds with a lot of sleep medicines, but particularly with this class, is that they make you basically forget how poorly that you slept in a certain way. And so, again, just something to kind of keep in mind. In terms of the risks for this, so, there is a black box warning on this, so a pretty serious risk of, next day impairment. So you may not feel like you're able to function like you normally can. And you can develop a tolerance to it and a dependence to it. So, many people feel like they do need to increase their dose over time. And then also they feel like when they come off of it, they get this rebound insomnia, which can be, really unpleasant. And you do want to be careful using this medicine if you're going to be using it with, say, opioids or anything else that can really cause a lot of sedation. And that's generally with, all of the medicines that we're going to be talking about today, because they all cause sedation in one way or another. So when you're combining one medicine with anything else that causes sedation, you are at risk then obviously of over sedating yourself. So, just be careful about that, and obviously chat with your doctor about that. So that's what I got for you on the Z drugs. So the next class of drugs that I'm going to talk about, and these ones are ones that I don't prescribe at all, but I just want to include them in the discussion just for complete sake, would be benzodiazepines. So these are things like temazepam, triazolam, lorazepam, oxapam, all the PAMs basically. So the benzodiazepines, they work on the GABA receptor just like the Z drugs, but unlike the Z drugs, which just work on one GABA receptor, these work on all of them. And so what people find with benzodiazepines is that they do fall asleep faster. Sometimes they get their total sleep time increase initially, but then it decreases over time. And then it decreases REM sleep, and it notably decreases deep sleep. So, you don't get very good quality sleep when you're using benzodiazepines at all. And so that's why they're often not used and not recommended in the literature, because they just have a really, really poor effect on your sleep architecture overall. So, these really should only be used for like a couple night courses or less. Like the only time I ever prescribe benzodiazepines personally is if someone's going on an airplane and they just have this insane fear of flying. And so, I'm only prescribing generally, two tablets at a time, one medicine there and then one medicine for the return flight, that's it. Just because, they're very, very addictive. This is the class of medicines that Jordan Peterson was addicted to and had a very hard time getting off of. And, they do have, a risk of fall the next day. They can, decrease your memory, your cognition. You have very rapid tolerance. You can get dependent on them, as I said, just like Jordan Peterson did. They can cause some respiratory depression. And again, you just want to be really careful about using these because, they are just so dependent. They are so addictive. And so again, I would avoid using this class of medicine like completely, and again, the only time I prescribe for someone is when they're going on an airplane, and that's it. So let's move on to the next class of medicines, and this would be Doxepin or a H1 inverse agonist. So these medicines are not really prescribed very, very often in Canada anyway. It's also known as Silanor. And what these medicines do is that they inhibit the H1 receptor at a very low dose. So they're only using like 3 to 6 milligrams when you're using this particular medicine. And its effect on sleep, for sleep latency, it's usually fairly neutral. So it's not going to really help you fall asleep faster. It's going to potentially increase your total sleep times. So, you may find that you have fewer awakenings overall. And then its effect on REM sleep and deep sleep is generally neutral. So these are often prescribed for middle of the night awakenings in older adults. So people who don't have too much trouble falling asleep, but more trouble staying asleep. And so this class of medicine, does have some decent evidence for that. But again, you do have to be careful of side effects. Some people report, next day somnolence or next day fatigue, just not feeling their best overall. And you have to be careful too, because it can cause some urinary retention and narrow angle glaucoma. So, it's something that does have to be looked at carefully with the particular patient, because if there's, some of those contraindications I mentioned, then, it's definitely a big no-no. It's not one I can really comment on too much personally, because I've never prescribed it before. And so, I'm just going to leave that one there for now. So again, it is Doxepin, or known as Silanor. It's an H1 inverse agonist. Overall, the effect on sleep architecture seems to be fairly neutral, except for it decreases the awakenings, which some people do struggle with. So, it could be effective for some people for sure. The next class of medicines that I'm going to talk about are going to be the Gabapentinoids. So these are going to be your medicines known as gabapentin or pregabalin, which is also known as Lyrica. And these can be helpful for people who struggle with sciatica or have nerve pain. It's actually the one on the list that I actually have taken before. So I've taken this when I had my back pain back in 2023. And I even had to take it a little bit during the daytime. So just a very low dose because, I just had so much pain. I needed something to help with the nerve pain that I was having. So for people who are really struggling with nerve pain, this can be, a game changer at night. If you're not struggling with nerve pain, it's more like an off-label drug, but for people with nerve pain and also with restless leg syndrome, it does seem to be fairly effective. And its effect on overall sleep architecture is not too bad overall. So, you have a decrease in your sleep latency, so you are going to fall asleep a little bit faster. It does increase your total sleep time, which is positive. Your REM sleep seems to be neutral or potentially even a slight decrease. So it does depend upon the dose overall. Usually it's prescribed between 50 to 300 milligrams. So again, pretty wide dosing range there. And then it does actually notably increase deep sleep, which is, pretty interesting because, many people do struggle with getting enough deep sleep at night. And again, so it's going to be helpful for people who have, a lot of like hyperarousal at night or anxiety, restless leg syndrome, and also people who are in pain. Many women who have perimenopausal night sweats also find this medicine to be effective as well. But of course, it does cause some side effects. So let's go over those. So you can get some dizziness. Weight gain, unfortunately, is often reported, and edema. Next day sedation. There's a little bit of a respiratory risk also too when it's combined with opioids or benzodiazepines. So combining this with opioids and benzos is, a bit of a no-no. Certainly, you'd only want to do this under the very close attention of your medical doctor. And overall, it can cause, like I said, just a little bit of decrease in like cognition. And so you may not feel as sharp when you're taking this. Again, when I was just taking like 50 milligrams, I didn't notice, too much of a cognition decrease. And also you have to kind of weigh like the risks and the benefits. Like if you're in a ton of pain, then your mind is kind of like just on the pain. So you're not going to have good cognition anyway. If your pain is a little bit decreased and you take this medicine, then you're going to get less pain, which may actually be helpful for your cognition in that sense. So it's not something that like potentiates or like is going to increase your cognition on its own. But if you have pain and it takes away that pain, then by default, you're going to be getting potentially a little bit of a cognitive boost there. So again, these medicines are generally known as gabapentin or pregabalin, also known as Lyrica, and they can be useful for certain instances for people who struggle with sleep, and particularly for people who have nerve pain or restless leg syndrome. And I should mention too that this one too is prescribed off-label for generalized anxiety disorder as well. And so if you do have anxiety or like, just like hyperarousal at night, it can be effective for that as well. So let's move on to another class of medicines. These ones are a little interesting. These are your alpha adrenergic agents. So the ones particularly that are prescribed are clonidine and then also prazosin. So clonidine is a central alpha-2 agonist. It's often prescribed off-label for sleep, but it's also prescribed for ADHD, for insomnia, and occasionally for PTSD-related nightmares as well. And so what are clonidine's effects on overall sleep architecture? So it can decrease your sleep latency, which is fantastic. Total sleep time, it can also increase that as well. For your REM sleep, it's going to vary at different doses. So at low doses, it may in fact even increase or be neutral at your for your REM sleep. And then for deep sleep, it's kind of mixed, but it may decrease your REM sleep as well. So not necessarily the greatest on overall sleep architecture, but not the worst either. So this drug can also cause some side effects as well. So it can lower your blood pressure, lower your heart rate, put you at risk of hypotension or low blood pressure, and get you at risk for falling. It can also cause some rebound hypertension if you stop. So if you're using this drug, for weeks to months, and then all of a sudden you stop, you may find that your blood pressure actually rebounds higher than it was at baseline. And so you do need to be, really careful about that. And again, obviously use it under the care of your physician. What about the other drug that I mentioned under this class? So prazosin. So this is a peripheral alpha-1 blocker. And prazosin is kind of interesting because it's one of the only drugs that's really used specifically for nightmares. And it has quite a bit of evidence for that. And so, I've had many patients who have used prazosin, and they've told me that they've had, the best night's sleep that they've ever gotten by using this drug. But again, it's mostly for people who have nightmares. If you don't have nightmares and use prazosin, I'm not saying that it's not going to work, but it's going to work significantly better for the people who are experiencing nightmares. And as a secondary benefit, it can also help improve BPH symptoms as well. So benign prostatic hypertrophy or an enlarged prostate. So for men who have, issues with nocturia, going to the washroom too often at night, you may get like a 2-for-1 benefit there. So, if you have the nightmares again and the prostate issues, can be a great drug. So what are its effects overall on sleep architecture? Seems to be about neutral to maybe slightly helpful for decreasing your sleep latency or falling asleep faster. It can increase your total sleep time. For REM sleep, it's kind of interesting. It generally just normalizes REM sleep or has a neutral effect, but somehow it still decreases nightmares, which is, again, really interesting because generally when you have nightmares, it's usually during your REM sleep. And so you would think that if something decreases nightmares, then you may have less REM sleep. But it seems that it just has like a decrease on your overall hyperarousal, but it spares your REM sleep. So, it's great for people who, again, have nightmares and still want to get that good REM sleep at night. And then it has, again, a neutral effect overall on your deep sleep. So fairly good, evidence overall on sleep architecture. Risks, again, are going to be, fairly similar to clonidine. So orthostatic hypotension or, getting up too quickly when you're on this drug can really drop your blood pressure. So, you do want to be careful of that. And then, like all the drugs, you do want to start with a very low dose and then gradually increase it. This one has a very wide range. Generally people start off with 0.5 or 1 milligram. I've seen, doses up to 5 to 15 milligrams, which is, kind of crazy. But generally speaking, I think most people, get away with 1 or 2 milligrams per night with using this. And again, obviously, do this on the care of your physician if you are, considering using this particular drug. So, just have a couple more classes to go here, but I'm going to be talking now about the sedating antidepressants. So this is one of the more popular ones that I find anyway is prescribed in Ontario. It's called trazodone. So it's a serotonin antagonist and reuptake inhibitor. You may find that to be a little bit odd that it's a serotonin antagonist, but that is the classification of the drug because there are various different serotonin receptors. So it's not like if you have a particular drug, it can't act on serotonin in different ways, meaning that it can't antagonize or decrease one type of serotonin receptor and then be a reuptake inhibitor and therefore increase the other type of receptor. So just to kind of give you a little bit of a clarification on that. And this is, as I said, classically an antidepressant, but it is prescribed very, very popularly off-label for improving sleep maintenance. And so it decreases your sleep latency. So the time that you takes to fall asleep increases your total sleep time. It can decrease your REM sleep, unfortunately, at some doses, but it does increase your deep sleep. The risk for this, again, going to be next day grogginess, priapism, although it's very, very rare. So that would be an erection that you can't get rid of. And it does have quite a few interactions with a lot of other medicines. So, unfortunately, it's not something that can be prescribed with a lot of other medicines. And usually it's, done under the care of a psychiatrist if it's going to be prescribed with other medicines. But again, very, very popular drug. And the way that it really works, even though I mentioned that it's a serotonin antagonist and reuptake inhibitor, is that at low doses when it's prescribed, it acts on your H1 receptor, just like the Doxepin drug that I mentioned earlier. And because of that, that's what really gives its sedating properties overall. But again, you may have some next day sedation with that. You just may not feel generally as well. So, again, something that you do want to discuss with your physician. Let's move on to another sedating antidepressant that's prescribed off-label. This one is going to be called mirtazapine. Again, similarly to trazodone, it's very potent at the H1 receptor at low doses. And so because of that, that's what's going to be causing its sedating effect overall. And what that usually does is that it's going to decrease your sleep latency or how fast you fall asleep, increases your total sleep time, has a neutral effect on REM sleep, and increases deep sleep. So, fairly good profile overall, for improving overall sleep at night. But unfortunately, it's one of the, nastiest side effects overall. So the big one is going to be poor appetite control. And oftentimes it causes people to have weight gain. And so, because of that, a lot of people just do not like using this drug. No one likes to gain weight. Again, it is something that does have a lot of interactions as well. If you are someone who is suffering from depression or from anxiety, again, because it is traditionally used as an antidepressant, it can be effective for that. So, there are some people, again, who, swear by this drug and find it to be, very helpful. But, you do want to be careful potentially with, some of the weight gain that may come with using mirtazapine. Let's move on to some other medicines that are prescribed off-label. Strangely, there's a medicine called quetiapine or Seroquel, which is known as an antipsychotic, which again, I know is, kind of sounds dangerous just right off the bat to a lot of people. And I totally understand that. This also, too, has a similar mechanism of action to trazodone and also to mirtazapine for getting people sedated. And that's why, and it's because it acts on the H1 receptor at low doses. And so, because of that, that's what, gives its sedating effect that's going to help you fall asleep. How does this affect sleep architecture overall? Generally decreases your sleep latency, increases your total sleep time, unfortunately decreases REM sleep, but may give a little bit of an increase in your deep sleep, although the evidence on that is fairly low overall. The big thing with quetiapine is it has really bad effects on your metabolic health overall. And so it can increase your lipids, it can increase your blood sugar. Some people are going to report weight gain, and all that happens in a dose dependent manner. So, possibly at a low dose, you may not experience as many effects, but as you increase the dose, you're going to get more of those effects. And again, just for a lot of people, using a medicine that's going to cause weight gain or cause any kind of metabolic disturbance is just not going to be for them, which, again, I completely understand. So those are, mostly the medicines that I had for you there today. But I just wanted to throw in one more there just because it's kind of interesting. But again, this medicine is only used for people with narcolepsy, and that's going to be sodium oxybate. And so what sodium oxybate is it's actually GHB, just like the illicit drug that's on the street. So, there's essentially no difference between the two, unless, of course, you get, something on the street that is, laced with other things, which is obviously is. And, this is not for people with primary insomnia in any way, shape, or form. It's very, very, very regulated, as it should be. And it's only for people with narcolepsy. But, I just found it be something kind of, I guess, interesting overall. When I looked at it, I didn't realize that, people were using GHB for narcolepsy at night to help them sleep. And so what this does is that it actually has a profound effect on your overall sleep architecture. So it can decrease your sleep latency, increase your total sleep time substantially, preserve or have a neutral effect on your REM sleep, and have a significant effect on your deep sleep overall. So, again, it sounds like, a great drug, but there's many, many side effects to this. And, it has a lot of abuse for a lot of potential for abuse, which is why it's only prescribed in very rare cases for narcolepsy. But, it has kind of come up a little bit on social media and some other places recently. So I thought I'd just, discuss it, just for completeness sake on everything overall. So those were basically, the medicines that I had that I wanted to outline here today. There's nothing really, I don't think, that I missed overall in terms of, what is generally prescribed in Canada and the United States. But again, just coming back to what I said at the beginning of the podcast, don't use sleep medicines if you can avoid them, because, like I said, they all have side effects. Some obviously are worse than others, but for some people, they can't sleep at night, and not sleeping at night is oftentimes going to be worse than some of the side effects from these medicines, not from all of them, of course. And again, you want to do this under, the care of your doctor, but you're always looking at a risk benefit ratio. And, sometimes using lower doses can have a profound effect on sleep and maybe not increase side effects too much. And so, in those instances, I do think that, using a sleep medicine, is the right thing to do overall. But again, just make sure that you try everything else before you try any sleep medicines. Guys, so thank you so much again for listening to this podcast. I really do appreciate it. If there's anything you think that I missed out or that you want to comment on, please leave me a comment or send me a message, and I'll be happy to take a look at it. And as always, thank you so much again for listening, and I'll be back with another episode soon.